John, thank you very much for being here.
Thank you, Jim. Thank you, Russ. Good morning. And Russ, I accept your deputization as a representative of the National Physical Activity Plan. My name is John Dreyzehner. I'm a physician engaged in public health practice for nearly 20 years. Since 2011, I've been the 13th Commissioner of the Tennessee Department of Health. The department was created in 1923 in response to a repeated epidemics of infectious disease, like the yellow fever epidemic that in 1878 took the lives of 10% of the population of Memphis. A century ago, it was infectious diseases that were killing us: tuberculosis, influenza, pneumonia. To be sure, we still must do battle with infectious diseases in our One Health world. We know that. But today, our nation is suffering from an epidemic of chronic disease, a preventable epidemic, enabled by the places and spaces and relationships that shape our choices and can challenge our health on a daily basis. This is the health crisis of our time. Like those who led the way against infectious diseases, our children's children will judge us on how we emerge from this crisis. Lurking behind this crisis is what we in Tennessee call the Big 3+1: physical inactivity, excessive caloric intake, tobacco and nicotine addiction, plus other substance use disorders. Taken together, these account for all 10 of the 10 leading causes of death in Tennessee and in our nation. It is the Big 3+1 that are driving our health crisis, taking years from our lives and life from our years. Physical inactivity, excessive caloric intake, tobacco and nicotine addiction, plus substance use disorders are not separate and distinct entities. They are linked. Each of them delight our ancient dopaminergic reward system, the wiring for our very survival embedded deeply in our brain. So where to focus? Where do we see the light peeking through? As a nation, we're coming to realize that merely doubling down on downstream healthcare spending, most of which is actually sick care, doesn't work. We have to focus on prevention. We cannot spend or regulate or treat our way out of this crisis. We can't wait until we fix our massively expensive and broken healthcare system to prevent preventable disease. But we can prevent our way out of this health crisis through primary upstream prevention interventions, physical activity being the most impactful among them. As a state commissioner of health, I didn't start this job thinking that physical activity and the lack of it in our culture would be the most important issue I would confront, but I have concluded it is the most powerful. In a very real way, physical activity is a healthy drug with healthy side effects that counteract that Big 3+1 and provide many other quality of life enhancing results that we are still learning about. Yet we know and spend less on physical activity from a research standpoint than we do many a drug class on the market today. In spite of our intuition about physical activity's ability to transform health, education, and economic success, we need to know more. But like our forebears combating infectious disease, we need to move rapidly forward with what we do know, that physical activity is a near universally available, low or no cost, quality of life year expanding, and life enhancing intervention. If this were truly a drug, it would be a blockbuster. That is why this National Physical Activity Plan is so timely and essential. It provides important new guidance and approaches to make a culture of health a reality in our nation. And focusing on physical activity has the potential to move us rapidly as a nation towards greater health equity and optimal health for all. We know that the places and spaces where we live and the choices we make with the people in them can impact our health more than our genes, more than our income, and more than our access to health care. That's why we need to move schools, communities, businesses, local governments, faith-based communities, and other NGOs to create the conditions that support physical activity opportunities. In Tennessee, we are engaging our communities through an effort we call the Primary Prevention Initiative. This initiative, created nearly 4 years ago, aims to shift our focus to the upstream determinants of health in order to protect, promote, and improve the health and prosperity of people in Tennessee. The Tennessee Department of Health is putting skin in the game and thinking creatively about the role of our public health workforce and partners in an upstream primary prevention solution. We have charged our teams with being part of the solution. They're getting out of the walls of our health departments and out of our health clinics and are working with planners, educators, faith groups, economic development groups, and elected officials on ways to improve health through primary upstream prevention of chronic disease. A great example of a primary prevention initiative is a run club, a school-based physical activity opportunity that allows a child, even the most vulnerable, of any ability, to compete against themselves in a peer environment that is supported by trained coaches and mentors and fosters a lifetime habit of joy in physical activity. We know we can't do this work alone. We're pleased that the Tennessee Department of Health, along with the Tennessee Department of Education, Economic and Community Development, and Transportation, are launching a Tennessee Livability Collaborative. This is a health in all policies approach, emphasizing physical activity and active built environments, working with diverse stakeholders, aimed at stimulating economically strong, life-enriching communities. Concurrently, in Tennessee, we have a state plan for population health improvement that serves as a policy driver for our department and its partners. We're creating a physical activity component to this plan that will link communities and opportunities and incentives for positive action to create the places and spaces that support the joy of physical activity. As one young Run Club participant told her mentor not long ago, "This is the first time in my life I feel like a kid." Physical activity has the power to literally reshape our nation into a more economically sound, socially vibrant society where we can all feel and do our best. We are excited to utilize this National Physical Activity Plan, but we are even more excited about the potential of where it may take us. Thank you.